My name is Elizabeth Reece. I'm a board-certified pediatrician at the Southeast Georgia Physician Associates at the Camden campus in St. Mary's. When I went through the different rotations in medical school, my very first rotation was OB, and so I remember delivering the baby, and I was just like so on this big high because it was my first night of call, and I got to deliver the baby. But instead of staying with the mom, I followed the baby, and so I think that I just always thought pediatrics was it. And when I did my pediatrics rotation, I just loved it. It was just like the perfect fit. Pediatricians usually will treat from birth to about age 18, or typically when kids graduate from high school. So that's our clientele. So we'll go to the nursery here at the hospital, and each of us take usually a week of call at a time, about every 5th week, and see all the babies in the nursery. And so we just treat kids. We try to help the parents with what stage of development their children are going through. We see them for well visits because there's a lot of growth and development that goes on between birth and 18. So with my free time, I like to cook. That's probably one of my favorite things to do. I like to eat a little too much. I like trying new restaurants, trying new cuisines, cooking. That's probably the most fun. I like to travel with my family. We're trying to sort of just show my son more of the world. We went on a mission trip to Haiti so he could kind of see what it was, to how lucky we are in America, how much we have, and how much people do without in the rest of the world. He's gotten to go on a trip to Italy in the past, just to investigate different places in the world. I don't want him to be scared to kind of go out there and see the world and see that there's people that are different than him. We like to hike and walk our dog. And then I really want to learn how to stand up paddleboard, but I haven't gotten to try that yet. So that's my big goal for the new year. On the personal side, I think when you're picking your physician, though, that it's like any relationship. You might hit one that you're just sort of like, personality-wise, we don't really gel. And I even tell parents, when we see them at the nursery and they follow with us in the office, if they end up seeing a different provider and they like somebody else better, I said, it's not like at the hair salon where you're not allowed to pick somebody else in the same hair salon. You can pick a different one of us if you want to, because we really want you to be comfortable. And sometimes you just like someone's style. Like I'm wearing a lab coat today, but I don't tend to wear a lab coat in the office because I'm always afraid it kind of scares the kids. But some people prefer to have that and a little bit more. Some like to be kind of told more directly what to do. Some like to, go back and forth and have that conversation and help to make the decision and what, route we're going to take with their kids. So I think you just have to feel a degree of comfort, just like you would in any relationship. If something feels off, then you can search on and find the right person.